Hello and welcome to our Transformational Healing Seminar, and welcome Abby and Rachel. So why do we have these seminars? What's the purpose?
Educate people.
That's true. What else? What are the reasons why we have these seminars?
To heal people.
So people can heal, right? Why do you think that is? Like, what's the whole purpose? Like, could you think about this? Do you really need more information? I mean, you have Google on your phone. Do you really need more information? I mean, you could just stay on there forever and like look for information, right? But here's the most important thing. The reason why we have seminars is to give you the principles. Because principles are how you filter information through. Make sense? Because how many times do you read information from one source that gets contradicted by somebody else from another source? Now what do? But principles and laws of nature never change. Like what? What's this law?
Gravity.
Which says?
What goes up must come down.
Does it ever change?
Nope.
1895, 1955. It's always the same. So the way we can filter information is through principles. If you understand principles, that's how you win. Because in today's world, there's going to be a lot of deception, right? It always has been. I mean, just think about the last 5 years. What kind of deceptions we've been, been forced into, believing. So the principles are the most important thing. Here's another thing. Do you want to be the same person that you were yesterday?
No. You
want to be changed, right? The information and principles that we share with you is so you can be changed. And you know what else? It's not about us. About other people, so they can have the capacity to share the principles, so they can have a changed life. Because if you don't change, you just stay the same pattern again and again, and life gets boring and not having any more fun. So with that, we'll start right away. So tonight's topic is holistic chiropractic solutions for childhood ear infections. So let's go with that. So our mission, by the way, is to provide the innovative technology in holistic health and life care, helping people achieve lasting wellness and resilience to life stresses. What does that speak to you, Abby? Pick one word out of there, and how does it speak to you?
Lasting wellness.
Lasting compared to what?
Like temporary.
Temporary, which is what? Traditional model, temporary.
Just like fixing a symptom versus targeting the root cause of something.
Root causes, exactly, or causes even, right? Just a multiple. So yeah, and that's really, so everything that we do in our practice, and Rachel will tell you, we have a million things we're doing all day long. It's bad enough that we both have ADD and we get totally we could freak ourselves out, but we filter everything through this. Right, to the mission that we have. And also our catalyzing statement is to inspire people to live extraordinary lives so they can be a beacon of hope for others. We need to be ones to light each other's candle. And I think from the short time that you've been here, I hope you're seeing that we do live this principle, right? We're here to light each other's candle because not everybody's going to have a bright candle all throughout their life. So what's the basic principle? Your central nervous system is your operating system that runs everything in your body. It runs your life, right? Think about if you have a computer. Let's say you have a brand new phone. What if you have no software? Can you use it?
No.
You ever buy like a phone on like Amazon that's unlocked and you have no software? It's not going to work. So that's the reason why we make sure that the master controller of your body is in proper optimum health. Because the principle is what? If you have 100% connection between brain body, you have 100% what?
Function.
100% function. It's simple, right? However, when we have life stresses, what are they? What are the basic stresses? Open book test right there.
Yeah, it's chemical, physical, mental.
Yeah, those are all the stresses. By the way, is anybody here exempt from that?
No.
If you are, let me know. We'll have dinner and then we can share the secret of how to get away from all this. But stresses happen. So guess what? When you have those stresses in life, guess what happens to your nervous system? It starts to then get subluxated. That's what subluxations are, by the way. It's your body's capacity to try to adapt to life stresses. Because if you didn't have subluxation, your bones would just break. Would that be good?
No.
That would not be good. So the body goes, hey, hello, I'm trying to help you here. But the problem is, the design is it diminishes the function of the body. So when you have this subluxation, it actually inhibits the expression of life. It's like a cancer cell in your body. By the way, you don't need a lot of pressure on the nerve to affect its function. How much do you think? This is a study from University of Colorado. Dr. Chung Hasu over 40 years ago, and here's what they found out. So if you put your hand like this, pretend that's a nerve, right? Go like this, and then take your pinky, put it on top of that. Is that a lot of pressure?
Mm-mm.
That's equal to 40 millimeters of mercury, or the weight of a dime.
Mm-hmm.
If you put that pressure on the nerve, within 1 to 2 minutes, you'll decrease the function by 60%.
Wow.
How are you going to know? You don't, because there's no symptoms. Does that make sense? Mm-hmm. Is that a valuable principle to understand?
Yeah.
Yeah. So we were born with optimal health and function. That's your God birthright, right? When you get stressed, you get subluxated. When you get subluxated, your autonomic system doesn't function properly. The sensory motor system doesn't function properly. Guess what happens to your organs and your body function? It starts to glitch, right? And then next thing you know, you have a lack of ease in your body.
Mm-hmm.
And then, what's the last stage? All kinds of symptoms.
Mm-hmm.
In our traditional model, what do? We get rid of these, and we think we're
Fine.
healthy.
Mm-hmm.
You're either sick or you're well, right? You're not. There's actually a gradation. See how far away?
Mm-hmm.
And that's what's unique to the chiropractic philosophy and principle, is that we understand root cause. There's many different steps that you don't just happen overnight. Anybody have like a hole in their tooth, like a cavity, right? Do you just go to the dentist and go, happened yesterday, see? Really?
No, it takes years.
It takes years for that to happen. So do subluxations. The challenge is your teeth, if you have problems with it, they hurt. And you do something about it. Your spine doesn't always hurt. And that's a problem. And that's why we check people for subluxations, whether they have symptoms or not. Here's what happens when you get subluxated. That's a dark one, huh? Okay. So your body goes into high sympathetic tone, which means what? Fight, flight, freeze, right? If you're in fight, flight, freeze, can you be in healing, growth, and repair at the same time?
No.
You have to pick one. And that's what subluxations do, because your body goes into a high sympathetic tone mode, and that's what happens to a lot of people. But again, what symptoms do you normally have? Not always anything yet. The effect of subluxation is so damaging that back in 1921, Dr. Henry Windsor did a study. He was actually from the University of Pennsylvania, pathologist. So what does a pathologist study, Abby?
They study dead bodies.
Yes, exactly right. They study dead bodies. And they wanted to know, hey, what effect does subluxation have on your health? So he took 131 cadavers that have died of many different causes, different symptoms, different diseases, and he would take the organ that that person died from, take the nerve from that organ, trace it back to the spine.
Mm-hmm.
He found two important findings. Guess what they were? Whatever that person died from, that part of the spine had either the most arthritis or a curvature or a scoliosis. What's the principle? You damage the spine, you damage the nerve system, you stress the nerve system, you damage your health. It's just the way it works. Does that make sense, though?
Mm-hmm.
Have we even talked about pain yet? No pain. There's nothing to do with pain yet. By the time you have pain, by the time you have that hole in your tooth, it's been going on for a long, long time, and sometimes you can't come back. You can always have new teeth. It can cost you millions of dollars. You don't get it. You can't get a spine transplant.
Mm-hmm.
So childhood ear infections is very prevalent. It's called otitis media. It affects 5 out of 6 kids by the age 3. It's very, very common. Symptoms are ear pain, fever, fluid, drainage, irritability, and they're just miserable. And people end up in the ER several times. And unfortunately, the traditional model, it's not something that they really care too much about because nobody's dying, even though it's miserable. So they basically give them antibiotics, right, which doesn't really get to the root cause. And if you look at the federal guideline studies, which we'll actually make notes to pull that up next time, is that 80% of these resolve without any. But as a mom, you don't want your kid to be suffering, right? So we just freak out about it, and so the antibiotics, they don't work because that's not usually the problem. You don't have a deficiency of antibiotics in your bloodstream. That's why you have ear infections.
And it's usually viral, not bacterial.
Yes, exactly right. Think about that. Right? If you have a virus, the antibiotics don't work. And we'll talk more about that in terms of the mechanism. The problem is that you're afraid of is you have chronic hearing loss, speech delays, and recurrent ear infections if you don't fix them. First subluxation happens when? So the subluxations happen in the upper cervical spine. Guess when? Birth. If any of you have ever had kids that, it's not like a zipper that opens up like, hello, mom. I mean, there's a lot of pushing and pulling and tugging. As a matter of fact, this is from Beck's obstetric manual. That's supposed to be a normal delivery.
That's
right? Look at that. They twist, they rotate the baby, not considering this. When the baby comes out, can they even hold their head up?
Nope.
That's the first subluxation that happens. And it's a very common thing then that the upper cervical spine from the birth process affects the lymphatic system, so the lymphatic system can't drain. And also the Eustachian tubes in the babies are different from adults. It pulls up all the fluid, and when you have fluid, you have bacteria and viruses that can live in there. Mm-hmm. And also they're growing so rapidly too, and everything's in the mouth, they're touching everything. So the nervous and immune system are learning still, and that's really what's important. So the most important thing with chiropractic is removing the subluxation. And as you know, with the way we do things, we use the muscle testing to apply kinesiology to be very specific where those subluxations are. It helps again with the Eustachian drainage. So some remedies that people can use to help with this are such, and you can take a picture of that if you want. Vitamin D, zinc. Again, we muscle test for everything, right? Omega-3s, probiotics. You can use garlic oil, mullein drops, elderberry syrup, lymphatic drainage massage that can help too. We use the laser, it makes it so much easier. Staying away from things that can irritate the gut and also cause inflammation. And the nice thing what we have is the homeopathic remedies, like the 911 spray and the pain relief sprays, which is non-harmful to the kids. Mm-hmm. So keep in mind again, remember that physical, emotional, chemical, there's always those three causes. It's not just a subluxation alone, although that's the effect of all the stresses. Questions so far? What's the takeaway so far from what you're seeing? Any takeaways so far?
Well, that there's other ways to take care of an ear infection versus just
By the way,
going to a doctor and getting an antibiotic.
Right. Are ear infections normal?
No.
They're common. They're not normal. See the difference?
200
years ago, was tooth decay.
No.
It wasn't normal, but it was common, yes? By the time you're age 30, 200 years ago, you probably had like one tooth. You know what I mean? And then you had wooden teeth or something, because they didn't understand. Now, has biology changed?
Mm-hmm. No.
What has changed? Is our awareness of hygiene. Makes sense?
Mm-hmm.
And also cleaning and toothbrush and so on. So nothing's changed with regard to how the body is. It's just a matter of we have more subluxations in today's world. The nice thing is we have, do we have the laser? Did you turn off the laser? We should probably use grab the laser real quick, please. And so the violet laser that we have is actually antimicrobial, right? You can just use the red one, that's fine. It has antiviral effects, and it disrupts the biofilm. It also helps the lymphatic system drain. I don't think we've used that. Did we use that yet?
No, I haven't seen it.
Okay. And then also, so the laser, the violet one here, and so you can turn this on in a second here. It's effective for all ages. We actually use that also for infections in adults also. So this it doesn't hurt anything. research highlighting it. And that's the laser here. You can see the different frequencies that you can program in. This is a PubMed's study back in 2021. Pulse blue light inactivates 2 strains of coronaviruses. Right? So what you could do with this, thank you. See the violet and red? So what we do, ladies here and that work with us in a home, we do the sinuses, the mouth, thymus, gut, and the brain. Clean up the brain every day, and that's a natural way to do it. And the nice thing about the Erchonia laser, it's a class 2 laser, it's non-thermal, right? And it doesn't, you can't never ever hurt yourself. And the Erchonia laser is the only one that actually has 22 different FDA clearances, which means it does what it's supposed to do. And the double-blind clinical trials to do that. So usually we can use it in the mastoid process, which is right here. You can use it in the Eustachian tube, the lymph nodes too. You could use it there. TMJ, the cranial sutures, you can use that there too. The gut, the thymus, we talked about that already. And you do it several times. Again, in our practice, you don't just use it to use it. What's the difference that we do, Abby? We muscle test everything to see if you need it, right? Because again, you don't want to overutilize things. Everybody's body is different. Every kid's body is different. Have we ever adjusted babies in the same way ever?
No.
No, it's always something different, right? And it's changed. So when we always do the cranial, so after we adjust them, we distract the occiput and the sacrum to allow all those subluxations to kind of glide themselves. It's usually very, very gentle. You just hold that place, and sometimes it'll move, but you just hold the cranial bones and then the sacrum, and then allow it to glide once you remove those subluxations. So other nutritional supports for adults, especially, we have the zinc, vitamin C, vitamin D, My Community, Immunoplus. Those are things that we will help our adults when they have any symptoms. Silver is another one that's a natural antibiotic if it is indeed bacterial. Lauricidin, greens, probiotics. Guess what else too? See the laser here? You could program this to different frequencies. You see those? Those are all the frequencies you can program in here. And sometimes you can't just go, oh, it's virus. It's like, no. You can muscle test it. It could be yeast, it could be bacteria, it could be different types of parasites, it could be sinus, it could be, you see this? So these are programmable. And again, it can't hurt you, you know? And we have a technique called NMT, or neuromodulation technique. Guess what that is? It's basically a quantum mechanical view of how to, anybody here know how to change settings on their phone? Right? If you want to change apps, you want to delete apps, you want to apply apps, or if you want to change settings on your social media, dark mode, whatever, you could do the same thing to your autonomic system. So that we have pathways on here. For example, you have the immune system integrity pathway. One of the most common ones that we use are infectious agent pathway. I actually did this with Sylvia the other day, and she went away to for Christmas, and she was allergic to dogs. And she's like, oh, I'm going to be staying with my family for like a whole week. I'm going to be staying on the couch where the dog was. It's not going to bode well. We did it, the pathway, and she came back, and she's like, I had no symptoms at all.
Awesome.
So also another thing called the toxin pathway. It's another pathway you can use. Sometimes you have all these symptoms. It's not because you have an infection. Your body's toxic. And if you have a dump, you're going to have rats in the dump, yes? How do you get rid, if you get rid of the rats and you poison them, but you don't get rid of the dump, what happens?
They come back.
More rats come back. It's not the same rats because they're dead, but other rats, not the same ones come back, unless they're ghost rats. That would be freaky. So zombie rats. Does that make sense? So what happens then is that if your body's toxic, there's a toxin pathway, you can unwind the whole system. So we have the mechanical Newtonian model, which is adjustments, right? But really it's also neuronal and quantum, because you're really looking at the nerve function. And we have this guy here also, more the quantum light. But you also have the quantum in terms of changing the settings in your nervous system. So you have many different approaches instead of like, well, I'm just going to adjust you more. Right? What's the saying? When all you have is a hammer, the whole world starts to look like a nail. You know what I mean? It's like, where's a nail? You know, you don't want to do that. More is not always better. And you already know when we muscle test, like, haven't we used the percussor also? Mm-hmm. Right? That's not in the spine. Well, if you twist your spine, what happens to the rest of your extremities? It all gets twisted. Yeah. Well, the babies, they're still growing. Everything's constricted. And that's why you have all kinds of issues. So we always look at the whole body as a matrix. It's like a Rubik's Cube. Right? So, and that's how you get the body to repair, because you get the opportunity to ask. It's very complex, and the logical mind can't fathom just the one thing. And that's the reason why, when we just talk about the hammer thing, that's a traditional model. A plus B equals C. Ear infections, antibiotics. If it doesn't work, don't you think as a scientist you should be looking into it more? Like, if it's not working, we're doing this 3, 4, 5 different times. Maybe it's not the problem. Yes? Mm-hmm. That's why the muscle test is so awesome. And that's why we have total comfort knowing whatever's going on. And as a mom, too, there's going to be times when you're going to go, you get so freaked out about it, especially if it's your second child and they have ear infection again and again and again. What else are you going to think? You keep thinking about the same symptom, yes? Mm-hmm. But when you do the muscle testing, it gives the body an opportunity to say it's not the ears. You can even look in the ears with the otoscope. But then it shows you maybe it's the upper cervical, maybe it's the C5. It's very complex. But when you do the muscle test, it gives your body the opportunity to get to the bottom line. So one of our first ever kids that we took care of was 6 months old. Eventually, there was no recurrence of ear infections. She's now 6. Remember we just sang happy birthday to her the other day? She started out at 6 months old having those ear infections. And she is, cool thing about it, the mom said when she turned 2, when she wants to get adjusted, she would actually tap on her spine and say, doctor, because she didn't say chiropractor, so she would just tap on her spine and say, I need to be adjusted. And kids are very attuned to their bodies, right? And they love receiving adjustments because they know when something's good for them. They smile and, they just really enjoy themselves. We've been doing this now for the last 33 years, and many kids have benefited from the chiropractic care as well. Takeaways. So what's the first thing? What does chiropractic do here? Enhances and drains the drainage of the immune function. The violet laser accelerates healing. There are natural remedies that you can use. And not only does chiropractic help with ear infections, how did we open, this evening? What controls everything in your body?
The spine.
Spine and nervous system. It's basically your operating system. And so, all people online, if you have any people that it's a common thing, kids suffer with this all the time, and it's unnecessary. And here's another thing that happens. Let's say you never corrected the subluxation, and all the symptoms you have was ear infection, yes? But the body never really fixed itself, the immune system. Now what are you going to have down the road? Can you see? You have all kinds of issues that the body, asthma and allergies and recurrent infections that never go away. They come and go. So that makes sense? Because if you never really correct the subluxations, the nervous and immune system never really adapt. It just stays in the weakened state. But if you're not muscle testing, I don't know how you find it. Because you could totally just adjust anybody, but you're not going to get the feedback if the adjustment was what's necessary. Can we get away from any of these stressors, by the way? No, can't get away from it at all. So, by default, why do we need to be adjusted? Think about this. It's called entropy. What does that mean?
The slow decay.
Over time, right? It happens to what? Everything. Why do you have to vacuum your rugs again? Why do you have to vacuum the floor again? Did you wash your clothes last week? Hopefully, right? Yeah. Are you ever going to not wash them ever again?
Nope.
Because why? It's entropy. They get dirty. Yes? So let's say you wash your clothes. Oh, does that mean you don't have to wash dishes anymore?
I wish.
Yeah, right? But there's always going to be dishes. If you want to eat, you're going to have dishes. So you wash your clothes, you wash the dishes. Oh, I'm doing all these good things to avoid entropy. I don't have to shower now. Yeah, talk to your friends about that, right? So all these things you have to do if you want a level of quality of life, because things go towards disorder, and that's what happens to our spines. Okay, how about brushing your teeth? Should you only brush your teeth when they hurt? Wouldn't that be nice? And stop brushing after they don't hurt anymore? Can you see how we're really missing the big point? Because we do all these other things in our lives to maintain a level of integrity and health, our nervous systems are ignored.
Need to be maintained.
Yes, and you have to maintain the level of functioning. Here's another thing that you may want to think about, because it's been in our vernacular for a long time. Preventive care, right? Sounds good. What are you preventing? A disease? That would be like, oh, I'm going to get in a relationship to prevent a divorce. You know what I mean? You're going to prevent the disease, so what are you really attracting? More disease. Because you don't have a plan on how to create health. See the difference? The whole point is to create health and not prevent disease. So the preventive mode is more medical model of, if you don't have a disease, you must be healthy. That's not the way it works. How does chiropractic help with the immune system? Dr. Perot, a chief of Cancer Prevention Institute in 1975, did a study. He took 107 individuals and he got them under chiropractic care for 5 years. And here's the cool thing, Abby. So he measured their immune function 22 different ways. Let's talk about 2 of them. One is called unscheduled DNA synthesis. When your DNA gets damaged, your body can repair the DNA because the DNA will produce proteins to then produce genes, right? Produce proteins, and then therefore, if the genes are healthy, then the proteins will be healthy. Then that means you will have good cells. If not, if the DNA is damaged, you produce what's called oncogenes. What's that sound like? Oncology, cancer cells. Make sense? So if you have unscheduled DNA synthesis, you have high levels of immune function. Also, there's an enzyme in the body called glutathione transferase S. And if you have high levels of that, the body can detoxify much faster. He measured 22 different parameters, and here's what he did. He took chiropractic patients with no symptoms and measured their immune system. He took cancer people that were diagnosed with cancer by their medical doctors, measured their immune system. He gave these guys chiropractic care for 5 years, the cancer thing, right? 5 years. Left these guys alone. What's the control group?
The one that he left alone.
So this is the sick group, cancer. So if you're going to get a control to compare if something worked or not, what's in the middle, in between these two?
The regular people that got nothing done.
And had no cancer.
And had no cancer.
Normal population. You get it? So no cancer, no chiropractic care. That's control group. Because these guys had no chiropractic care but had cancer. Then you measure immune function, immune function, immune function. Got it? Here's what he found after 5 years. The chiropractic group compared to normal population, right, had 200% greater immune competence than the ones that weren't getting adjusted.
Wow.
The chiropractic group compared to the sick group, the cancer group, had 400% greater immune response. That's significant. Well, 1975, the criticism, the study was what? Chiropractic had nothing to do with it. People that go to chiropractors in the 70s are all hippies. They eat granola. It's their diet, right? Not true? It's a criticism. Well, guess what? In Nature, back in 1993, look at this. The scientists have found the first evidence of an anatomical connection between the what?
Nervous system.
And the what?
Immune system.
Really? Oh, okay. We're just going to run through these quickly. DNA repair or thiol studies, they found here that, here's the thing, the white blood cells too were taken from people that were getting adjusted 15 minutes after the adjustments, And then they found that the white blood cell count went up every time you get adjusted. How are you going to know that? You don't measure your white blood cells every time you walk around, right? And then there's what's called a respiratory burst. So the respiratory burst actually helps your immune system function better. And remember that thing I was talking about with the CD4 count? This were like people with AIDS. They were adjusting them. So the CD4 count in people that did not receive care went down almost 8%. The people that were getting adjusted went by 48% increase.
That's huge.
Can you see what I'm saying though? So again, we're not even looking for, where's the pain? There's nothing to do with pain. This is my favorite. I found this myself. I gotta take credit for this. This is from Discovery. Look how long ago that was. That was almost like 10 years ago, right? Discovery magazine. Read that out loud, Debbie.
They'll have to rewrite the textbook.
Really? Heavy? Wow. So, read that out loud too.
It's a stunning discovery that overturns decades of textbook teaching. Researchers at the School of Medicine have determined that the brain is directly connected to the immune system.
Wait, go back to the what?
The brain.
Yeah.
Directly connected to
the what?
immune system.
Really? Oh, okay. But what? By what?
By vessels previously thought not to exist.
Whoa, we didn't even know there was stuff there. Because we're not looking. How these vessels could have escaped the detection when the lymphatic system has been thoroughly mapped throughout the body is surprising on its own. I really did not believe there were structures in the body we're not aware of. I thought the body was mapped out. This guy, Jonathan Kipnis, professor of the Department of Neuroscience and the director of University Center for Brain Immunology and Glia. Does that make sense? Well, guess what? Here's the way it's divided. The nervous system is divided into mechanoreceptors, nociceptors, and autonomic system. How many percent mechanoreceptors?
54.
Right, go like this. That's how you know. Close your eyes. You can still know where you are in space. Mechanoreceptors, right? Feeds back to the brain. 22% from nociceptors. Hot stove. Ow! Light touch. Pinching. Itchiness. Get it? Nociceptors. How many percent?
22.
What's the other quarter percent, which is 25%, is autonomic, which is sympathetic, parasympathetic, and what?
Immune system.
It's by design. I didn't make it up. I wish I did take credit for it. That's the reason why. How many times, Rachel, have you heard people bragging the last month or so? Oh, everybody around me is sick. My friends are sick. The kids are sick. Yeah, my husband, who doesn't get adjusted, is sick. Like, I'm not sick. Yay. And I say, that's not by accident. That's by design. Because we're looking to make sure the nervous system is functioning, and that's the way it was divided. What a nice benefit, right? You don't get any negative effects. You always get positive effects when you do something good for the body. Came up with this too. The quality of our health and adaptability and resiliency is proportional to the clarity of communication between the brain and the body. Principle never changes. And when you diminish that communication, that's also put in here, right? It's not your health. Put in their relationship. Put in their spirituality. Put in their finances.
Yeah.
He made it all the same thing. Couldn't even go beyond 10. So if you get in trouble, we're just a phone call away. You can always get scanned. Most important thing is to get your nervous system balanced. Now, why is this a heavy burden for us, Abby? Because you know what? How many people know about this stuff? Did you know about this stuff?
Not really.
Yeah. And and you're pretty holistic yourself, right? You're kind of thinking you live through stuff. But again, the problem is, I apologize on our profession's behalf, we haven't told you the whole story. We've already told you that the chiropractic was for pain, for back pain and neck pain. It's nothing to do with that. So we ask you to pass that on to people that you know. Be the light. Just like when you share God with everybody, they're not always going to accept it, but you planted a seed. They planted a seed that the principles, so when you refer people to our practice, don't refer them necessarily to come in as patients. They're not going to understand. Have them come to the seminars. Have them watch our YouTube channel. Have them watch our videos on Facebook and so on, so that they can then understand before they need us to be here. Just think of someone you know. So the last thing I want to do this after we leave online here, is I want you to write down 3 takeaways of what it is. And what we're going to do is we're going to post that on our board so then people can say, oh, that was what the takeaway from the seminar from that evening. And we're going to put a title on top of there. It's going to be holistic approach to ear infections, right? And make sure you put the date on there too. Our next seminar, which is next week, is Discover and Eliminate the Root Cause. Anybody here know anybody that, like, especially mostly women, have chronic anxiety and depression, and kids too that are like suicidal? This is our answer. We've done NET for a long time, and that's a really amazing approach that is holistic and it's also quantum. So anybody online, please type in your questions. We'd like to connect with you. We're on social media. We're on Facebook, Instagram, and on YouTube, and we need to be more active on there, but help us do that. Share this with everybody that you know. And drmariano.com is our website as well. And with that, thank you so much for being here. And we'd like to close with this quote from Henry David Thoreau. He said, "I went to the woods because I wished to live life deliberately, not just by social media. I wanted to live deep and suck out all the marrow of life, to put to rout all that was not life, and not, when I came to die, discovered that I had not lived." And that is Henry David Thoreau. So thank you again until we see you in our next seminar. Have a good night.